Okay, start the meeting.
Yep.
Board Member Carroll.
Present.
Board Member Harville is excused. Board Member Kaplansky.
Present.
Board Member Rastetter.
Present.
Board Member Maturu.
Present.
Acting Chair Skinner.
Present.
Director Bashane.
Here.
Commissioner Manzola.
Present.
Okay. Should I take over then? Is that how this works?
Okay.
Okay. Everybody, I ask for your patience. This is my first time doing this. So I guess we have to move to approve the May 28th, 2020 minutes. I have looked at them. They look fine to me. So I move to approve. Do we maybe have a second?
I'll second. It's Tessa.
All in favor say aye. In favor say nay.
Aye.
Approved.
All right. Which allows us to move on to continued business. Which I believe we'll return to Commissioner Mazzola for that. This is the COVID-19 pandemic updates and discussion to start with.
Okay, well, good evening. Yes, good evening. Thank you very much. Good evening to the board and to staff. Appreciate again being able to join you this evening. Of course, first and foremost, I hope everyone is well and staying healthy. Few updates, maybe I would just, I'll add that I'd like to share with the board this evening. Franklin County Public Health continues to certainly be very much basically 100%, 24 hours a day, 7 days a week on COVID response. We have right now approximately 75 of our staff who are working in some capacity with respect to COVID-19. And again, just for your reference, that is out of about 112 of our staff. So we still have a very significant footprint with respect to the response here in Franklin County. Let me go through a couple of pieces of information just to share with everyone. Let me make sure I reference our dashboard here. I just want to give the board a little bit of an update with respect to case counts and some other things that that we'd like to make sure that the board is aware of. So as of 2 p.m. this afternoon, and I won't go through all the numbers, but as of 2 p.m. this afternoon in Franklin County, we're now reporting 8,310 cases, 1,018 hospitalizations, and we are now unfortunately reporting 378 COVID attributed deaths in Franklin County. In our health jurisdiction, in Franklin County Public Health jurisdiction, again, this is outside of the city of Columbus and the city of Worthington. We are reporting 2,088 cases of COVID-19, 257 hospitalizations, and we're reporting 98 deaths. Again, those numbers are inclusive in the county's numbers. I just wanted to share with the board a little bit of a breakdown there for the case counts for our health jurisdiction. I do want to say that in the city of Grandview Heights, we have 14 cases of COVID-19. I'm finally able to share with you that number. We really try hard to ensure that we don't share those numbers when the cases would suggest perhaps a breach in confidentiality. But when we get to a certain point over 10, typically, we're able to share some numbers with our local communities. And so we are reporting now 14 cases in the city of Grandview Heights. A few other updates I would share, just kind of speaking a little more broadly about where we are with the response. Since we last met, I would let the board know that testing has continued to become more and more available in our community. Want to acknowledge and recognize our hospital systems, community health centers, Columbus Public Health, and some local community partners who are really working hard to identify new partnerships and new opportunities to ensure that testing becomes more and more available. About 2 weeks ago, the state of Ohio made a decision to basically allow for COVID-19 testing for anyone who may feel like they need to be tested. So for a good portion of this response, it was very much really those who were exhibiting the most severe symptoms were being tested. And then as we went into April into May, that criteria changed a little bit. And then again, just about 2 weeks ago, the governor has now allowed for anyone, whether they're symptomatic or asymptomatic, that they can receive and get a clinician's order to get tested. And the reason behind that is obviously because our testing capacity has significantly increased. So now we can certainly make testing much more available. So locally, as that has happened, we have been working really hard to ensure that testing sites and testing facilities have the supplies that they need. So Franklin County Public Health has been facilitating the distribution of swabbing kits that the state of Ohio has been providing us. And so we're working to provide those kits, particularly to organizations like long-term care facilities and community health centers who may otherwise not have readily access to those kits. So we are distributing those on an as-needed basis. So that's one role that we're doing with respect to testing. Again, we have information on our webpage that we've been expanding on over the last couple of weeks to ensure that all of our residents understand that, again, should they feel like they need to have a test, whether they're exhibiting symptoms or maybe they are thinking, hey, I was potentially maybe at risk for being exposed to COVID-19. Maybe they were at a whatever the scenario may be, where maybe they felt like that their risk was such that they felt like they needed to be tested. They can now go ahead and do so. So that's a big development since the board met last month. Also want to let the board know that we continue to host weekly conference calls with our partners every Thursday morning to really kind of give a broader update with respect to our response. So we are going to take next Thursday off, but we're going to continue those briefings into July. And so we will continue to make sure that we, again, just trying to make sure that the most up-to-date information is shared out with our partners, with our community. And notes from those calls are also posted on our webpage. And I'll make links available to Megan to make sure that the board has those as well. And then kind of from a public relations standpoint, you may have seen a few days ago that the state of Ohio released some new public service ads around social distancing and the use of face coverings. And so those will be additional ads that the state will run to really encourage the use of face coverings and to continue to encourage our residents to stay, I guess, vigilant about keeping a good social distancing between you and others and really taking those necessary precautions. So Franklin County Public Health will be certainly sharing those ads on our social media sites and would potentially encourage the city of Grandview Heights and others to share those as well. They're really well done and they really send that strong message about the importance of them and the effectiveness when you do use your face covering. And of course, continue to keep that 6 feet of separation as well. So from a communication standpoint, want to continue to reaffirm those messages and make sure that we are getting that word out as best we can. And then finally, from an enforcement standpoint, there is a continued sort of regular a number of complaints that we're receiving at the health department with respect to various businesses and other questions about whether it's guidance that was released for certain sectors or the governor's orders and state orders, et cetera. So I believe the number is over 1,500 complaints that we have received now since March, and we have resolved each and every one of them. I'm really proud to say that. But we do continue to receive them. A good majority of them have to do with restaurants and bars, and a good majority of those complaints have to do with the use of face coverings. We continue to do extra outreach to our operators and business owners. We made a new partnership this week with the Columbus Chamber of Commerce to really find new ways to communicate to our business partners about those expectations, and we're going to continue to look for those opportunities moving forward. So from an enforcement standpoint, we continue to stay very busy and want to make sure that we continue to educate first and make sure that the operators are aware of those expectations. I always want to go in with the mindset of education first and foremost. And 8-9 times out of 10, that's what it takes is for us to make that phone call if needed, to go on site and make sure that we address whatever issue may be occurring there. So still, again, I guess in summary, really just a lot of activity still at the health department with respect to COVID-19. Cases continue to be, I would characterize them as steady across Franklin County. We are anywhere between 20, 25, 30 cases per day within our health jurisdiction. And that's probably been for about the last month. I know we've seen some uptick in cases statewide. And of course, we're seeing in the national media, many states are seeing a significant increase in cases. I think as we kind of look towards next month, we are being, we're hopeful, though we're not, comfortable in kind of where we are. We certainly wouldn't be surprised if we saw additional cases, sort of an uptick in cases as the summer progresses, and then of course looking at back to school as well. So we are again trying to remain very proactive in our communications, very proactive in our engagement with our local communities, with our businesses, and our residents, because this virus is still actively spreading throughout Franklin County. And though we understand that things have opened up, we also understand that we want to keep those core messages with our residents so that they can, make very safe choices as they continue on with the summer. So I think I'll pause there. I'm happy to answer any questions that the board may have. And again, thanks so much for the opportunity this evening.
Thanks, Joe. Any questions, comments?
Hey, Joe, in terms of contact tracing, any difficulty, any challenges, anything that, extensively, in terms of, contacts or the 14 cases in Grandview, I guess, specifically to this call, any issues reaching other people that business owners or whomever, any issues with contact tracing? How's that going?
Thanks for the question. I would say overall contact tracing has gone very well, given the magnitude, given the certainly the different barriers that might come along with contact tracing. And thank you for bringing it up, because I do have an update there and I forgot to share it. So we have been fortunate to receive state dollars from the Ohio Department of Health, where we have now onboarded 20 new staff to do contact tracing. And so just to put that in perspective, prior to COVID, we have 4 people who do contact tracing for all infectious disease, not just one, but for all, so, to bring on 20 additional staff, they'll be working 28 hours a week, and they're going through training right now. It's going to be a huge lift for us, and or I should say a huge benefit for us, to ensure that we continue to keep up with our contact tracing, and will position us well in terms of any potential increase in cases that we may see as the summer goes along. We're also contracting with a firm called the Healthcare Collaborative of Greater Columbus, which some of you may be familiar with, HCGC, as we like to say. The collaborative is the home of our Central Ohio Pathways Hub, which employs community health workers through community-based agencies. And so we're going to be contracting with HCGC to employ community health workers to do additional contact tracing for us in hard to reach populations and to reach residents who may be most at risk for us not being able to reach them in terms of contact tracing. So really excited to be able to partner with HCGC to ensure that we are working with organizations that are trusted in the community, that we can partner with, and then so that they can then make those phone calls and that outreach with us on behalf of Franklin County Public Health. So from that perspective, everything's going fairly well.
That's fantastic. That's good to hear.
You kind of answered my question, but I just kind of want to come at it from a different way, especially because we're going to talk about race tonight at some point. The diversity of the 20 new folks are thinking about cultural competence and that approach. Is that to come with HCGC, or is that already in place? How have you approached the question of reaching different populations and language and all that?
Yeah, the focus there is with our contract with HCGC. They partner with so many organizations that give us that diversity and that cultural competency aspect. So when you think of English as a second language or other certain at-risk populations, it really helps us be able to partner with those organizations that are part of the hub through HCGC. So that's absolutely one of our strategies there. All of our staff go through cultural competency onboarding training. Certainly, in this case, it won't be as extensive as working with partners like HCGC, but we certainly are very mindful of that and pay a high priority for that. And as we kind of work through contact tracing, we'll be kind of going through a process to ensure that whether it's our staff or whether it's through HCGC, that we're ensuring that we're doing all that we can to be working to appropriately engage with our residents.
Great. I have one other thing, but any other questions that anybody wants to raise or comments? I have
just that
please, go ahead.
I just wanted to say, just that I second or put it on the minutes, that I think we really need to look at some of the ad campaign that came out from the state and think about how we can adopt that into Grandview. I think we need a sign right on Grandview Avenue that says "Welcome to Grandview, wear a mask" or something, and it says people on Grandview Avenue are definitely not reading that sign as they travel through. So, and Dan, I know think you.
Yeah. So, a very specific question I have. On just literally a half hour before coming here, I walked by an ice cream truck. 18, I saw up to 22 kids, not one mask, no social distancing, a block from my house. What's going on with ice cream trucks? I mean, I've been here 6 years. Actually, I haven't seen ice cream trucks in Grandview, but maybe I've missed them. But they've been around a lot lately.
I thought that there was an ordinance that they weren't allowed in Grandview, or that was what I had been told. I've never actually read it, but we've lived here 14 years.
Yeah.
And I will agree. My kids
I have a picture of them. I took a picture of the truck today. Actually, it was 22 kids at peak, and parents. So, anything specific about ice cream trucks, Joe?
Well, only
it's a
to say
question,
that,
but
yeah, only to say that we have similar experiences in my neighborhood. So we, I'll have to get back to you on the technical answer. I don't know the specific guidance on mobile units, so to speak. Food trucks, ice cream trucks. I'll get back to you on that. I'm sure it's posted. But to your point, it is concerning where we have, these scenarios where so many kids are sort of congregating. And so I've literally seen it in my neighborhood too. So happy to get back to you on that. But it does kind of beg the question, kind of what can we do to certainly continue to encourage our families to be more cautious. And that's, a whole other conversation that we talk about back to school as well. There is a big educational opportunity for our families and for our kids to ensure that they are taking, proper steps in terms of protecting themselves and others. So interesting you brought it up. I literally just happened yesterday. Here in my
Okay, thanks.
Write that down.
Okay. And Joe, did you have a second part, a non-COVID part to your comments that you wanted to get to?
I do have maybe just some general comments outside of COVID, which I'm happy to provide now or later in the meeting.
Well, the agenda is not clear unless I'm reading it wrong on that. So we might as well, unless anybody objects, have Joe just give us the full 360.
So really not much more to share, though I do want to give 2 quick updates related to environmental health. And my apologies, I don't have full reports this evening for the board. I appreciate the board's forgiveness for not having those reports. I will certainly work to have those quarterly reports for you, but monthly, particularly in the midst of the pandemic, a little difficult for us to put together. But a couple of highlights I just want to share from an environmental health standpoint. Our food safety section reports nothing pertinent or out of the ordinary. Standard inspections for our food service operators in Grandview, no complaints, no investigations, and no administrative or board actions taken for any operators in the city of Grandview Heights. And then just wanted to also let you know that we are actively testing now, trapping and testing mosquitoes across Franklin County. So far we have had no positive West Nile mosquito pools in and around the trap that is placed in and around Grandview Heights. And so, but we certainly will keep the board updated. We've had no service requests submitted by the general public for mosquito spraying or whether it's adult sighting as well. So again, just for the board's benefit, residents can submit service requests and operators or business owners and the city can submit those service requests through our website. We'll be happy to do some pre-treating in and around the community. And then certainly if we have a West Nile positive pool or if we have a certain level of the number of mosquitoes that we're catching in our trap that would give us some concern, we of course always reach out to the city before we do any spraying in the community. So, but right now, we will our mosquito traps were just placed a few weeks ago. So, but we will certainly keep the board updated as the season progresses. And those are the only 2 other updates I wanted to share.
Great. Questions, comments for Commissioner Mazzola?
Just to interject, if we're moving on the new topics, you might want, or if you would consider hearing out the director of Grandview Heights Public Library.
Of course. Director?
Good evening, everyone. It's a pleasure to be here. Thank you for the opportunity to come before you and talk a little bit about the library. I've been in some conversations with the city administration as well as the mayor, and we thought it would be a good idea to give you guys a little update, talk a little bit about the library, the response that we've had during the pandemic, also highlight where we're at with our current service offering, as well as talk to you about some of the challenges that we're facing. Can everybody hear me okay? Okay, I think there was a little kickback there. So to start off with, I wanted to give you a little background about the library very briefly to put some things in perspective. The Grandview Heights Public Library has almost 20,000 active users. We're arguably probably one of the busiest and most visited physical locations in all of Grandview Heights. We circulate about 600 to 700,000 items to the public every year. We log almost 30,000 public internet sessions a year. We do close to 20,000 in-person reference transactions a year. We have over 800 events, and our annual event attendance exceeds 40 to 45,000 attendees every year. So it's a very busy place. Obviously, a lot has changed here during the pandemic. In addition to running the library here in Grandview Heights, the public library is also the administrator as well as the fiscal agent for the Central Library Consortium, which you may or may not be aware of. So the Central Library Consortium is made up of 17 library systems here, spread out within Franklin County, as well as all of the adjoining counties of Franklin County. And Grandview is actually the administrator for that organization. So it pretty much includes everybody in Franklin County. We have either partnerships with or they're part of the consortium. Real quick, just to put things in perspective for the size of organization we're talking about, we have 1.3 million active card holders, more than 50 locations. We circulate more than 67 million physical items between the consortium and Ohio Link. Our annual circulation amongst just the libraries here is 26 million items a year. So a lot of transactions, a lot of people, just to kind of put things in perspective for you. Wanted to talk about the current services that we're offering right now. Obviously, we're following all of the CDC as well as the Ohio Department of Health guidelines. The physical building is closed to the public right now. We have been offering high-speed internet access in all of the city parks. We've been doing that since 2014. That, along with all of our ebooks and databases and online material, has remained available throughout the pandemic, as well as high-speed internet at the library. Obviously, we've been purchasing a lot more ebooks and e-audiobooks to try to keep up with demand. In April 4th, we switched over all of our programming to online programming, as well as story times. We're doing online programming now 7 days a week. You may be aware that we also installed the Story Walk at Buck Park down on Goodale, which has been very popular. On May 19th, we started curbside pickup of materials 7 days a week. So patrons can place items on hold online. They can call. We offer online services as well as online chat. And then patrons can pick up items 7 days a week at the curb. That has been going extremely well. One of the challenges that we face is we are quarantining all library material returns for 72 hours prior to handling them and making them available to the next batch of patrons. So that's a fairly large undertaking to make that happen. We have also launched several new mobile apps in the last 2 months, including our first ever virtual summer reading club and partnering with the schools. We've also resumed physical delivery of materials to our homebound patrons. We have quite a few patrons who are unable to come to the library for health or physical reasons, and we do deliver materials to them and have for years. That service has resumed. We've also started our cargo network up between our 50 locations. So things are starting to open up. The physical building is remaining closed at this time. That kind of brings me to my next topic that I wanted to make you aware of, is some of the challenges that we face. We obviously face all the same challenges that your traditional retailers face, making sure that we have sufficient PPE and cleaning supplies, updated safety and security policies and procedures, obviously doing social distancing, wearing masks. A lot of our staff are still working from home. We're divided up into 3 teams because we're a 7-day-a-week operation, so we don't have crossover amongst our teams. So those are very similar to retailers. In addition to retailers, people use the public library very differently than your typical retail store. It is not uncommon for people to come into the public library and spend hours and hours, and sometimes all day, in a public library. Also, generally speaking, and not to generalize things too simply, but usually when you go to the grocery store, You tend to only touch the things you're going to take. You tend to take them home, and rarely do you return them. In our situation, virtually everything they touch, they take home, and then they bring it all back to us. So we handle about 50,000 physical items a month being returned to us. So we have quite an extensive quarantine operation. And that's just Grandview location, the 50,000 a month, not all the other libraries. The easiest way for us to maintain that is through curbside pickup. We have very large bins that people return items through in our book drops, and they are wheeled into a quarantine room. It is not uncommon for us to have several thousand items a day coming in, and then they're quarantined and tagged for 3 days, and then they're handled and made available to the next patrons. Just a little bit different. Some services still remain unavailable. In-person things like notary services, tutoring, computer assistance are still no longer available at this time. We're hoping to eventually be able to return some of those, but not in the short term here. Of course, feedback from our community has been overwhelmingly positive. We are very appreciative. Lots of positive feedback about the online programming and curbside pickup. There are some patrons who really miss physically browsing materials. You should look for an announcement next week from us. Our next step will probably be offering outdoor browsing, actually. As you look at the guidelines coming out of CDC, doing things outside, lots of fresh air, lots of sunlight, lots of social distancing. We have a phenomenal pop-up library that hopefully you've all seen that we take to the parks and the schools. It will be available. We have a permit coming for a large canopy outdoor tent, lots of colorful book carts that'll be moved outside. And for several hours every day, patrons in the community will be able to come and physically browse material to be able to take home. I go through my notes here. That's kind of our next stage. There are no immediate plans of opening the building, and our meeting rooms will continue to be closed for the foreseeable future. As far as curbside pickup goes, we will probably be offering curbside pickup indefinitely at this point, at least through the remainder of this year, and in all likelihood, it will remain a permanently available service. It has been very popular. In a 4-hour shift, we usually see 100 people and 500 checkouts. So it's a fraction of what we normally do, to be honest, but it's still pretty significant numbers. And now that our cargo network has been reactivated, those numbers will continue to grow. I really appreciate your time. I'm happy to answer any questions about what we're doing, our concerns, really any questions you have about the library at all, I'm happy to answer. I also serve as the chair for the governing council for all 17 library systems within the consortium. Most of them at this point are doing a variety of different things over the next few weeks, some lobby service, some limited browsing, some computer appointments. We're trying to take this slow, but at the same time, meet the needs of our community.
Great, thanks so much. I'm sure I speak for others when I say thank you. You're doing amazing work. It's extremely thoughtful and hard work. And the library is critical to our community. So,
well, we really appreciate that. We're really fortunate here. We have an amazing staff, an amazing group of volunteers, frankly, and the community has been extremely supportive of our work. So thank you.
Comments, questions?
I second that. I think the fairy hunt that you guys have pulled off is phenomenal. I would love to see that, promoted. I just think it gets people outside, and I think that people, at least walking by our home, has been able to distance, and it just provides something really cool to do. So I know it was a week long, but I think it's really good and encourages people to move around. So I haven't seen any. I don't know if other residents have seen any abuse of that. I haven't seen like a ice cream truck incident at all around somebody's fairy garden, but
yes.
But I would say, like, for the outdoor, and I think that's I think you're right on the outdoor, there's a lot of guidance coming out from the CDC and a lot of research that's going into the idea of how much exposure do you need to somebody with the disease in order, and you know, it's not usually just like a tag type thing. You got it. It's more long term, and so being outside with sunlight, etc. But just to prevent that food truck sort of scenario at the outdoor, is there like set kind of guidelines that you're thinking about to prevent a bunch like 20 kids run into the cart?
Absolutely. So I should have gone into that a little further. First, we won't be making any public announcement until next week, just to let everybody know about this.
Yeah.
But it will be in the east parking lot, very close to where we do music on the lawn. We will have limits on the number of people that are allowed into the area at a time. The displays are going to be 10 to 12 feet apart from each other. We're going to limit to 12 browsers at a time within a very large area. We will be encouraging people to wear masks. Hand sanitizer stations will be available as they enter and leave the area. Staff will be required to wear masks. We'll also be discouraging people from reshelving material. It'll actually go either to be cleaned or go into quarantine after people are handling it. I did fail to mention earlier that libraries are actually working with Battelle here locally on an international level to evaluate the long-term vitality of the virus on different library materials. The research has been going on for about 2 months now. Initial phase 1 research was published last week, and it confirmed our 72-hour kind of quarantine. Where we're most concerned about usually is the surfaces that are somewhat easier to clean. You know, the Mylar book jackets and the plastic seem to last a lot longer. But library materials, as you know, people take them home and they spend hours and hours with them. So that quarantine component is really important as it comes back.
Great. Thanks so much for answering that.
Absolutely.
Other questions, comments?
I do appreciate the efforts that has gone into keeping library services available, because we're very sad when we were not checking out books for a long period of time, and very happy when we can open the trunk and pick up some new material.
Yep. Keep using curbside. Call us up. We have staff available 7 days a week to help place stuff on hold. So I'm glad you're using the curbside. It's very popular, but thanks for the feedback.
It's been great.
Good.
Great. Well, if there's anything we can do, please do keep us in the loop. We appreciate the updates for sure.
Yes. At any point, do not hesitate to reach out to me if you have any questions after this meeting. I'll be happy to come and talk again. I'm available via phone and email. So please don't hesitate. And thank you for the work that you're doing. We really appreciate it. This is a phenomenal community, and everybody's participation and hard work is really appreciated.
Great. Okay. Well, thank you very much. Thanks for joining us. Yeah.
Have a great night, everybody.
You as well. So we have other business, and I do believe the other business was sort of circumscribed a bit because we received an email from President Keeler. I guess this is a question for Megan. Was the plan to move on to that specifically?
I'm not aware of an ordinance or anything I was given to pass out to everyone.
Okay, so that's confusing to me. Just because did everybody receive the email on the board from President Keeler with regard to the resolution?
Yes.
Okay. So would the board like to take that up and discuss it for a bit? I mean, she had asked for our feedback essentially on that, and I think it's important and timely, and we have a limited amount of time before the council needs to act on that. So if there's no objections, we move to that.
Sounds good.
Okay, great.
And I think it'll be good to have Commissioner Mazzola. I don't know if he'd been sent it. He's off screen now, but.
Mm-hmm. Yeah, and for context, the resolution itself was inspired, as so many things are, and in this area by Franklin County Public Health, taking lead on declaring racism a public health crisis in our area. And the resolution was offered by Council Member Melanie Houston, and the council discussed it and referred it to us for further discussion. So who would like to start us off with some thoughts or framing questions?
Well, I had sent an email that was outside of, but was considered to be okay. But that I agree that I thought it was important that the Board of Health echoed the guidance that came out of Franklin County Public Health and the Franklin County Commissioner specifically calling out racism as a public health crisis. We are under the jurisdiction of Franklin County Public Health, and so I didn't think there was much real debate or anything that was. It was just I wanted us as Grandview Board of Health to state that and to put out something because I'm not sure. I think, and this gets to, and I know they're moving sideways here, but I think it gets to like what our core ideas are about what our Board of Health can do. I mean, I think some of it is echoing things that are coming out of Franklin County locally, right? And I think this is a big one. And Franklin County has been really, and Columbus have been leading the way across the country on this announcement that they put out about racism. So, but kind of tangentially, I feel like Councilwoman had put through a more comprehensive declaration, which I liked. I thought all of the points were good. And Joe, I don't know, did you receive it by chance? I don't know if that came to you.
Sorry, the mute button was being a little finicky there. I don't recall receiving it. It's not to say that I didn't, but I don't recall receiving it.
Sure. Okay.
Well, we can make sure that gets to you, of course. So, Mark, you want to start off with there's specific items in this amplification of that Franklin County approach that you wanted to bring up or that came to mind? I mean, I don't know what the task of this board is other than to affirm it or offer input or suggestions. But I do think that your point is a good one about, and I think this is something that COVID has done for many of us is raising the question of what a Board of Health can do in a place like Grandview Heights. And whether this moment is an important one, there appears to be a role for us in this resolution as written. So I'm curious about any more granular thoughts.
Yeah, I think that's what I was hoping to bring because I see a lot that comes out. Obviously, the mayor's done a good job of putting out guidance around COVID and with a statement from the office, and I didn't know if there was some opportunity for us to do the same. And I would love more marketing around the Board of Health and social media account, et cetera. I don't, but I'm new here. But just to sort of echo a lot of the things that are coming out from our partner and our guidance from Franklin County Public Health. So I'm not sure regarding what I would like. I mean, I like that idea. When the mayor puts out things, she puts it out on social media and makes guidance. I think having a channel to do that through the Board of Health would be something I'd inquire if that was a possibility, not only for something like this, but obviously in the middle of a pandemic. I don't know. I mean, I think, it would be interesting to see how it plays. Letters to local businesses in Grandview that come from, and Joe, Commissioner Mazzola, I appreciate your feedback of whether something like this is done across other boards as well. Something that says, Grandview Board of Health recognizes Franklin County's guidance on COVID and restaurant, just little reminder, from the local community that we're on top of this too. I don't know. So I guess some of my things are more questions or seeking feedback of what we can do. But I do feel like we should be doing something other than, meeting and hearing all the good things that are coming out of Franklin County Public Health.
You're kind of putting the question to Commissioner Mazzola if we're a average Board of Health
Yeah.
and how we could be above average.
Yeah.
Well, I would say that you're an above average Board of Health for sure. But let me just, if I could, give you maybe a couple of thoughts. When our Board of Health adopted the resolution declaring racism a public health crisis in May, we were the first Board of Health in the state to do that. And since then, we have seen now Board of Commissioners, City of Columbus, Columbus Public Health, City of Whitehall, City of Westerville, City of, what was the last one? Reynoldsburg, and I think we'll have a couple more follow suit here, in addition to the hundreds of organizations and businesses who have reaffirmed ours and Columbus's declaration. I would love to encourage the Grandview Heights Board of Health to pass a resolution encouraging the Grandview Heights City Council to adopt a resolution. It sounds as if they're already thinking that way. I think it would be extremely appropriate and very much encouraging for the Board of Health to make that resolution in support of the city to move in that direction. And of course, Franklin County Public Health stands ready to work with every city across our jurisdiction, not only on passing these declarations, but then the work that's still ahead, the work that is ahead for us. We had an all-staff meeting this morning virtually, and I spent about 10 minutes talking about our declaration with our staff, and really acknowledging that that there is a lot of hard work ahead of us. But we cannot be a part of conversations around things like poverty, around things like education, around things like transportation and other social determinants, access to healthy food, access to medical care, those social determinants that we talk so much about. We can't be a part of those conversations if we don't acknowledge the systemic institutional racism that's existed in our country for decades and decades and decades. And so we are working on advancing policy change to address that. And that's another piece of our declaration, is that we have adopted health and equity in all policies. So our health department now is going to be, we're going to hold ourselves accountable to ensuring that everything that we do has a health and equity component to it. And when we talk about equity, it's for us, it is sort of our driving goal as an agency. And so equity is kind of at the middle of all of this. So I would encourage not only a declaration, but then kind of a, what are the next steps going to be for the city of Grandview Heights? What can we do as far as adopting similar things like a health and equity policy for the city of Grandview Heights, so that when they look at things like transportation or other kinds of investments in the city, that they're looking at it from a health and equity standpoint. So that's just kind of one example of a lot of different things that we're going to be looking at, both as a health agency, but then also as a community. But it's really, really exciting to be a community that has certainly been kind of in front on this issue, if you can say that. I mean, frankly, I think we're all behind on it, but we're finally starting to all collectively acknowledge that it's really time for us to not just get into those social determinant areas, but really dig deeper into these systemic issues. And so, we are excited to be a part of that conversation, and we're really excited that a lot of our local jurisdictional partners are taking this on and passing their own similar resolutions. I think Upper Arlington, I forgot them. I think they passed one a few days ago, I think on Monday at their city council meeting. It again, very encouraging, but a lot of work ahead. And I think that's where from the health department standpoint, we will certainly partner with the city on those next steps.
That's
It's
great.
really helpful. Really helpful. Any reactions or thoughts on the resolution as it was distributed to us that we want to communicate back to the council?
I had a couple of thoughts. I think it's a great resolution, and I like the focus on education, kind of along what Commissioner Mazzola was saying. In terms of the action plan, I had just looked at Upper Arlington's resolution as well, and I just think the section 2 part under the be it resolved, where that it does mention that we want to honestly and directly review practices and systems and structures, getting to that systemic racism that we talked about. I like the idea, of just bringing people of color to the table in this discussion. And Upper Arlington mentioned a community relations committee, something else to really identify what the inequalities are within our small community, and then identify if there's any systems that are contributing to that, and look at correctives in that area. Because I think if we really want to get to the heart of the matter, in addition to education, we need to think about our hiring practices, our contracting practices, and try to improve the diversity in those areas. And other areas that I probably haven't thought about, that maybe a more diverse group of people getting together in parallel to the 6 months, I think, with the racial justice learning, to come together and figure out what the inequalities are and how we can fix them. And I think we have enough stakeholders and community members in Grandview that you can get a diverse perspective.
Yeah,
Great
that's
point.
great. Yeah, it strikes me to add to that, the word I look for as a health policy person, I look for the word policy, and I hadn't quite thought about the way policy is talked about. Certainly, reviewing policy is important, and that's a really important step in collecting data, which is something that also this suggests. But not only reviewing practices, systems, structures, and policies, but developing or implementing policy to address them. It's not explicit as written here, and maybe we want to push more on that. That we act on what we find.
Yeah, I think it might keep us accountable. Just in case, the news cycle dies down. I think when we have things in writing, it keeps us accountable and keeps us moving forward. And then the other suggestion I had in the section 4, when we're talking about racial justice learning, it said focusing on, and this just may be wording, focusing on a history of racial injustice. And I think to add to that, maybe, the current racial injustice that has continued, and really thinking about implicit bias training. I don't know if that falls within that area or not, that we all probably should think about in this moment.
So that would be an easy fix in terms of adding the words "and history and present" of racial injustice. I think that's a good point.
If I may, there is a significant number of organizations looking at funding racial bias training across Franklin County. There's a lot of activity happening there, so I'm so glad that you hear that mentioned. That's one of the immediate next steps that we're going to be going through at the health department as well.
Great.
Yeah, we do it. I thought, and we had brought that up, and I think it sounds like the police, because that was the most immediate we were talking about, the police, and I think they have gone through implicit bias training, but I think that it should be mentioned specifically. I completely agree.
Yeah. Good. Well, those are some concrete things. Others? I just want to make sure that
I'm gonna review it again. I'm gonna be looking on screen here just because I wanted to review it again.
Yeah, we can take a minute to do it right. There was some question about, I guess, whether we were going to do this tonight. Anybody has a thought, just pop right in.
I guess I was looking for that idea that was mentioned about a committee, and I didn't see. Did you see it? Was there any mention about forming a committee? I had thought of like an appointment of an officer. I don't know if we diversity, equity, and inclusion, or a council of diversity, equity, and inclusion. Somebody who has some sort of official oversight, but that's getting into local government, and I'm not sure how that necessarily works. But I would be interested in however Arlington worded it in that resolution. I didn't see it,
They
but
said it, well, Upper Arlington's resolution said community racial
Yeah.
relations committee. And I think that includes community members, stakeholders, is my impression. And I like
So-
that idea quite a bit. And then I think, so I was trying to look at what Upper Arlington did in the past, and I think they previously actually established a committee. And then my belief is that the committee came up with ideas for more long-standing changes. So I think the committee suggested that they seek applications for more permanent members for the same committee, things like that. So I think a lot of those ideas came from the initial work group that was put together.
So is the goal, I mean, is this, because the way this resolution reads, it's mostly council driving these initiatives. Is Upper Arlington forming a committee, sort of like Planning Commission or Board of Health, or is it a subcommittee of elected representatives?
I don't think it's elected, but this is just from the internet. So I haven't talked to anyone. So it seemed like they were seeking applications, maybe like the Board of Health, how they're appointed is my understanding. I mean, I don't know honestly how these things work because I just started, but I think a committee where you had maybe a couple members of the Board of Health, a couple city council members, and then community members and other stakeholders, and just make it as diverse as possible. And I think we really can if we reach out throughout our neighborhood. I think there's a lot of diversity and a lot of perspectives that can be heard. And then sit down. I think, I agree that a resolution should be passed, and I think it would be timely to do so in the near future, but perhaps give us some room to slowly figure things out and put in the time that's actually needed if we want to solve problems like this.
Yeah, I mean, I watched my first planning commission meeting recently, and I think that given the importance of housing and the housing discussion in Grandview and inclusionary zoning potentially, that would be an important piece as well. So that might be one way. So how do we put this to council would be my question. And what do we want to
Right.
say back?
Can we say, and I put this out here for feedback, but that idea, like even of an appointed council and as we're appointed at the Board of Health, a council of diversity, equity, and inclusion, or whatever we might want to call it, that meets on a regular basis, like as we do, and reviews statistics, right? I mean, the Planning Commission could bring things there. The other people could bring things to review housing policies, and again, I think I think it'd be a great idea because I think these steps that we can take to, especially in Grandview Heights, to show that we're actually putting teeth into actions and resolutions are good. So, but I'm also mindful that I don't want to slow the progress and like
Right.
have it like skip another meeting because we didn't pass this resolution, and then like a month, 2 months, 3 months later. But
Yeah.
but putting something in there about a council or committee, and I guess I'd seek probably feedback from city council to see how best they think that could happen.
So I can say from watching the session where the resolution was introduced, the council meets in July for a second read, I believe. Megan can confirm if this is right, and then August, I believe, for what would presumably be a final discussion. So there's a little time for some feedback on this. And one of the questions, and so I guess two of the things I want to raise is, one question would be, is this something that there should be broader input in to this resolution? Should there be an opportunity for community comment of some sort, or what do they call that when people get together and say things? You know what I mean? A public forum of sorts. And the second one is, what kind of body are we looking forward? Many institutions at Ohio University where I work, we are increasingly involving inclusion and diversity in things that they weren't previously involved in before. Maybe such a body should have at least a pass by for Planning Commission and Board of Health and things like that to have a people that are specifically a group that is specifically looking for these kinds of issues that the other bodies might not be seeing. But the composition of that we could leave open.
In section 4, it does say, who they want to partner with. I guess, are you wanting that section 4 just to be more of a structured committee and not just input from the school, the library, us, and so forth?
So I wasn't just talking about section 4. Maybe I was miscommunicating with my colleagues here, but I think that the point was about all sections in terms of the reviewing of systems and policies. Really, I guess it's section
2. I
section
guess
2. It's section 2. Yeah, right. Like, do we want that to involve some kind of a standing? Would we recommend that involves some kind of a standing committee to make sure that it is done intentionally?
Yeah, that's sort of what I was thinking as I read it. Like in section 4, if we had it the way that we would, or the way that I was thinking, it would say Year of Racial Justice Learning by partnering in the Grandview Heights Public Library, School District Board of Health, Committee on Diversity, Equity, Inclusion, and community members. It would be another committee that would be there doing different work.
Yeah, I was more focused on the way in which the work of government is considering these dimensions of things always in everything they do. And is there a committee that they could go to have things looked at from this perspective, whether it's zoning, housing, health, sewage? I don't know what we do. We do a lot of things.
Yeah. Dan, I appreciate your opinion on how to make this, because I do think it affects health, right? So I think this is appropriate that we're having this discussion tonight, and when we're talking even about committees and getting things right about housing policy, and so I think it's important.
Well, we don't, we're not voting on this resolution, is my understanding. Megan can correct me. My understanding is they were looking for some feedback, and we're kind of giving that. I don't know how we synthesize it other than through the minutes. Any thoughts on that?
I apologize.
Yeah.
With the minutes, I'll make sure to include all the input you provided towards the resolution.
Yeah, okay. And that's really what they had asked for, I believe. I can go back to Emily Keeler's language, but I thought that was it.
So can I ask another question real quick? Joe, when you mentioned the city of Westerville and Reynoldsburg and those others, obviously it sounds like Up Arlington unfortunately is a little ahead of us in passing something, but is Westerville, for instance, was it their Board of Health that just put out a statement, or was it how did they go about that?
So these were all their city councils that took action. And actually, there's only 3 cities that have retained their local boards of health, and that's Upper Arlington, Grandview Heights, and Bexley. The Bexley Board of Health hasn't met in the last 60 days or so, give or take. So they haven't met yet since our declaration has been passed. And the Upper Arlington Board of Health hasn't met either. But all of the actions that I mentioned were taken by their legislative bodies, their city councils.
We have some work to do.
Did they consult with Franklin County then in some way, or was that just?
I'd say about half of them reached out, and we had some clarification conversations about our resolution. But about half just kind of went ahead and did it on their own, which is great. Yeah.
In the email that we got, they do ask for one of us to be there to convey, I guess, sort of summarize the conversation that we're having now. So I guess in addition to the minutes, if somebody is available on the 6th, that's what they're asking for.
Is that July 6th? I would be happy to do it. I will be in Pennsylvania with to be determined internet access, but I'll let you know if there's any problems. But unless somebody really wants to do that.
What time is council? Is it 7? I guess I can go back to my-
Tessa, is that August 6th, do you think? Because July 6th was Sunday, right?
It says
Um,
July 6th in the email. I'm looking at my calendar.
Oh, you know what?
Plus Monday.
It's a
It's a
Monday.
Monday.
Yeah.
Yeah.
I will try to be present as well.
Okay, great. Sure, the more the merrier.
Then I will also provide the minutes prior to July 6th.
Okay, that's a fast turnaround. Thank you. Appreciate that. 'Cause I'm not remembering everything for sure.
According to the city website, the meeting is at 7.
Thank you for
Okay.
that. I appreciate it.
So perhaps we could just take a minute to distill our key points then. The one point that I had made was to push a little bit on the importance not just of studying systems and policies in the section 2, but to include developing policies to address those findings as a commitment, which there seemed to be some support for. Is there any discussion on that, or thoughts or ideas?
I like it.
Okay, I just want to make sure I'm not out there. It seems to me reasonable because that is the difference between studying things and changing things, and I think we need to be committed to change. The second point that was brought up regarded the presence of a committee or some kind of body to carry out this work in a regular and systematic way, although whether it's a council committee or a kind of hybrid committee like the Board of Health or Planning Commission, something like that, we could leave up to them, or does somebody have strong feelings on what that looks like?
I just diverse, I guess. Diverse in terms of color and maybe probably residents and stakeholders, but as to how it's put together, I don't have a strong opinion.
Okay. So a committee that is diverse, broadly construed in its composition.
I agree. It should be, I don't think it should be city council doing the reviewing. I think it needs to be a broader group.
I agree.
Well, 400 people showed up to the march or something that we had, so presumably there are.
There is. I was encouraged by what I heard and was hopeful. But I think we need to keep pushing, right? Put on the gas.
Okay, so that's the second point. Was there a third point that I'm kind of skipping or missing there? What was it? I think there was.
In section 4 with the historical and current in terms of racial injustice, and then maybe I don't know how you can talk about implicit bias training, but just to reiterate that.
Okay. So 2 points there: history and present. We recommend in the language on section 4, if we could be so bold to make a language recommendation to the council. We make it as a recommendation, and implicit bias training or training as a commitment in some way in this resolution.
Some city councils, go through the training themselves and Board of Health. So I think across the board, it would be beneficial for all of us.
Yeah. And I definitely have good contacts at Ohio State and can could do some of that. I mean, I know there's online stuff, but and then in the schools too, right? So I think that's important, and how we could talk about every facet or branch of Grandview City doing it, I think is important.
And just so you know, I am part of this school's wellness committee because, and somehow it got they created a position that a board of health member has to be on the wellness committee, but that happened 2 years into my term. So I do talk about whatever we talk about here in those our quarterly meetings.
Great.
So their rule is that somebody from this body needs to be on that body?
Well, yeah, that is a new thing because I've been going to the meetings for 3 years because of things I do in the school for, foods and healthy eating and so forth. So they decided that I'm now the city's representative on the committee through the Board of Health. And
Congratulations.
Yeah, you are all welcome to stop into the meetings there if they are interesting.
Yeah, the one other question I just want to float. I know this is going back to discussion a little bit, but it occurred to me because since the Board of Health is specifically called out in Section 4, every conversation I'm having around Grandview, in line with the goal of this resolution, includes housing, and I would wonder whether we should specifically identify Planning Commission within that list. I mean, it's not a mandatory list; it's just talking about potential partners. But I think it'd be interesting to see if we could start that conversation about that being part of this as well. Just wonder if anybody has any thoughts. And maybe there are other committees. I don't even know all the committees that there are. Maybe there's others I'm missing. But it seems to me that housing is important. The school district is already called out there specifically. Just an idea.
I think it's a good one. And I'm pretty.
Well, then I would like to consider making that at least something for them to think about, just to make sure that the mission is real, which is we're talking about schools, we're talking about housing, we're talking about all sorts of ways in which racism operates within our city.
Absolutely.
Potentially, we have to study it. Okay. Anything else that we've missed? Okay. Is there any other business then that we have this evening? I don't have the agenda. The agenda kind of disappeared in my document here. I believe that's it. Is it not?
That's it.
That's it.
I do want to say that I second what Mark was mentioning earlier about being more present in the community. I think we sort of were starting, most of us are relatively new. I think I've been around for a year, but everybody is sort of younger on the board. And we sort of started having a little bit of momentum with doing things or providing education. And we were going to have the vaping forum the end of March, and that got shut down. But I agree. I think we need to, whether it's including a short speaker during our meetings. I know Joe had mentioned that they have these, I think he called them tracks, where there were people that could focus on specific concerns within the community and providing education. I think a Facebook or some sort of social media specific to the board would be great. I do feel like when I was asked to be on the Board of Health, I said we have a Board of Health, and I feel like that's how most people feel. So
yeah,
there's a lot that could be conveyed or helping the Franklin County to promote their the material they have. So I just want to second that.
I don't know what our city's capacities are in terms of just basic production of things, but I think it was 4 meetings or 5 meetings ago, we had flagged the possibility of doing a video I think that was actually about vaping, but now we might do a pro mask, like a TikTok. I don't know. Can we do a TikTok? I don't know how to do. Does anybody know how to do that? It seems like a thing. So
I'll leave that to the commissioner. I think he probably.
no, but I wonder if there's a way in which we could all do a very brief, like, and make it kind of fun, but we stitch it together. You know, they're doing that thing where you pass it to somebody else and, like, you know, that kind of thing. You stitch them together. I don't, you know, I'm just throwing that out there. I think that would
like
be
it.
fun, and maybe that's a way to say the Board of Health wants to remind you this is important, you know, and we could throw it together. It might be fun. Maybe there are other people in our community too that would be excited to do it.
Well, it does beg the question of, like, if we met tonight and said we wanted to do something, we wanted to, who would make that happen, right? Like, if we wanted to say, hey, I really want masking, so I want to adopt the state of Ohio and Franklin County Public Health masking signs and ad campaign and get them to somewhere, because it's obviously important that it be visible to restaurants, and we want to state Grandview Board of Health. Where does that go? Where does something like that go?
For approval.
You would do that for administration.
Through administration?
Mm-hmm.
Which means what exactly?
So you could bring it to, you could bring it to my attention like you just did now, and
Okay.
get it through administration.
Okay.
So did we just do it then? That was my reading. I mean,
Maybe we have more power than we think, I guess. I don't know. Because it should be. I mean, we think it's important. We're seeing a lot of problems with masks and in our community, and you know, it is important for us to be public facing. And
there was a meeting before COVID became as present as is that Mayor Kearns mentioned, that in the state of emergency type situation, we do have some pretty significant power. So I think for masks and so forth, we do have the ability to.
If she empowers us to do so.
Well, she said I remember, I don't know why I remember this, because it was early on, you know, there was this thing in China, but nobody was really paying attention yet. But she said, you know, if something happens, I hope that you work with me, but you are, you have the authority to shut it down if we need to. So
what do you? Well, I'll look at the state of Ohio's already. You know, maybe there's something that we can easily reproduce. I'm not sure if we're into making our own. But I saw that a tweet came out, and I retweeted about, like, it said, "Welcome to Columbus, wear a mask," or something like that. It was a very simple, like, "Welcome to Grandview Heights, wear a mask" idea. Just, you know, I don't know, just to show that we, from the Board of Health, want to put that face forward.
I have a quick question for Joe, if I can. It's something I've been thinking about. We focus so much on, you know, Franklin County Public Health, for example, investigating infractions. Is anything being done locally, nationally, to celebrate adopters? You know, people like, you know, to those who are doing really exemplary work, those who are leading. Like, do you know of any kind of programs like that?
In regards to COVID, or in regards to...
In terms of, like, masks, I mean, so for example, you can call Franklin County Public Health that somebody's doing something wrong, but what if somebody's doing something right? How do we acknowledge them to make that a norm?
I'm not aware that there is.
A sign you can put in your window, like a certification, you know, like you got a gold star.
Yeah. You know, I don't think that that we've identified a way to do that. And I think you know, we do want to acknowledge and celebrate that, and you know, really kind of reaffirm that. And I think that's where, you know, some of these communication messages, public service announcements, and you know, other kinds of tools, I think, are important. And so I'm not aware of any. If there are, I can say that certainly from our health department standpoint, we have a whole list of shareable resources that we've developed that the Grandview Heights Board of Health and the city can take, repurpose, rebrand. So whether it's face coverings, whether it's social distancing, whether it's in the for the parks, for businesses. I mean, we have a whole list of different creative that we've developed that you can certainly take and repurpose. And if you think of an idea that maybe we don't have, we'd be happy to work with the city to design something. We've got some pretty great resources regarding communications, a graphic designer, and some other staff who can help assist with that. So let me know how we can help.
Yeah, I know we drifted back to COVID for a moment there, but I just, it was the question of what can we do as a board, right?
Yeah.
So, well, we didn't resolve that. I don't know if there is an item for us to resolve or if there's some other point we want to reach on this committee, but I'm open to suggestions.
Is there any more public or input from the board that you would like in the minutes in regards to the resolution? Or have we closed that item temporarily? Not close it, but
I thought we had closed that,
Perfect.
unless there's something else.
No, I think you summarized, and I think we added the extra points.
Great. Okay, and so the last question then is really like, how do we? I guess do we need do we need guidance from administration about initiatives that we might take as a board and how to do that? The limitations of what approval, things like that, or just posing the question since y'all raised it.
I will bring to the administration's attention the desires for the sign or ad about mask wearing. I think that was one of the mentions. So, and, I apologize, my wording is not correct of your desires, but if you specifically tell me what you'd like brought to the attention of the administration, I will do so tomorrow.
I would like to ask for guidance on what Board of Health should do if we wanted to do a public service like social media, and think in those terms now and in the future around mask wearing, to start, for example, and social distancing.
Okay.
Maybe where we all approach a ice cream truck, for example, and I don't know, we could stage it. All right.
I had another question if we were taking it to administration, just as to how do we communicate between meetings about things like signs, and things like that we want to discuss via email, or how best to.
I'm sorry, you were cutting out. I'll go ahead and mute myself.
Yeah, and someone else may be able to answer this just because I'm new. I wasn't sure how to discuss things between meetings. Simple things like signs that are brought up, or ideas that we may want to proceed with or talk about or look at. Is that appropriate to do via email, or what's the best method of communication? I know that was brought up with the attorney, but I didn't know if there's any more clarification on it.
If there's anything I've learned from planning commission meetings that I've peeked in on, it's that signs are actually kind of a big deal in Grandview. So
What you could
Believe
do,
what?
you could submit your stuff to email to the clerk, Megan, and we can forward that to the administration for their consideration on what the path would be.
Or I don't know the right legal word for it, but I'm copying it and sending it. So
What are you sending us?
So within the city charter, there is it's essentially the rules for issuing orders and adopting regulations, and this is specifically for the Board of Health.
Oh. That's another thing I'd like to ask the administration for. I know that talking with some of you, there's a lack of clarity about what this board does and what our charge is. If we could just have all the formal language in whatever it is called, that'd be really helpful, I think. Just so there's clarity.
I'll send that to you.
Thank you.
Got an email from
Tessa, you're cutting out a little bit.
February 24th. We got an email from that has a link, and you can find us in there.
Yeah, you kind of cut out there, but you said you can.
Okay, check your email.
Okay, good. That made it through. Great. Well, I think this is exciting. This is why I wanted to be on a board of health, is to have substantive conversations about improving our community. So I'm really jazzed about this. Anybody else want to have any final additional items before we adjourn for the evening?
You'll need to talk about the next meeting that you want to set.
You mean when?
Yes. Yep.
I thought it was scheduled already, was it not?
It's not scheduled yet.
Okay. 1 month.
Is the desire to schedule for July, the fourth Thursday of July?
Okay. Maybe that works for me. Any
That would be the 23rd, July 23rd.
Second.
first?
Send out the notice.
I mean, we should check with our chair to make sure that that works. We could revisit it if we need to.
I'll send out an email to ensure that everybody's available.
Yes. All right. Anybody want to move to adjourn?
Move to adjourn.
Second?
I'll second.
Fantastic.
Great being on a call with everybody. This is
Okay,
great.
good seeing you. Hope you're all well.
Yeah.
All right.
Bye.
Bye.
Take care, Joe, and Megan, and Charlie.
Take
Bye-bye.
care.
Thank you. You too.
Thanks, Joe.
Thank you.
Let me know about those ice cream trucks.